Hello everyone, I'm here for Digit, and right now I'm joined by Miss Subha Vaidyanathan. She is the VP for EXL. And hi Subha, welcome
Hello,
on Digit.
Oman.
So tell me about EXL.
Absolutely. EXL is a NASDAQ listed company,
All right.
and we've been here for 27 years, and we have close to 63,000 employees. And we actually engage in multiple verticals. We provide IT services solutions across banking, healthcare, insurance, different verticals.
All right. So a lot of companies talk about AI in healthcare, but you are saying it's now making real-time payment decisions. I even saw it in the demo. So what changed recently that made this possible at Choice?
Definitely. So one of the problems we had in healthcare earlier was the data silos what we had. Fragmented data, which was actually creating a lot of leakage, dollar leakage especially in the system. So we right now have actually platforms which actually are able to get this particular data, do the transformation of the data, structured and unstructured data in form of claims and in form of actually medical records, and had the data processing much faster. So using our platform, 60% of the velocity is actually increased, making decisions to be more near real time. And we are actually creating this impact in the healthcare industry where we are actually moving from a pay and then actually pursue to more shift left and then actually do the analysis and then do the payment. So this is a shift left in the industry, which is actually being very favored by our clients.
But this is happening globally, right? If I'm
This
not
is
wrong.
happening
What
globally.
about the India plans? Anything?
Yes, we are actually evaluating the India market. Right now, we are in more of actually creating the talent, AI talent, but we are observing the India market and evaluating it as we see in the healthcare space.
All right. So there's a growing push to stop payment errors before money even moves instead of fixing them later. How does AI actually help catch these issues early, and where do humans still come into the process?
Absolutely, great question on that. So if you look at it, right, so a patient and a physician encounter, right, which happens, it is actually digitized and it is called as a structured claim. And then we have actually the episode which the doctor is recording, which is called as the medical record, which is happening. So both of these are analyzed, and we detect all of the anomalies which are actually happening, and this is being done real time. And this is actually shifted, and we have all of the AI solutions which are actually helping look at the medical record, being able to actually index the medical record, divide it into multiple sections of it, extract exact information which is actually required. After the analyzing of it, we do the auditing of that particular claim and the medical record to get a human in the loop closure, because it is after all healthcare of the people, and we have to be very very cautious about it. So that's where our human in the loop auditors, they actually work, they actually finalize the payment which is done for the claim, and that's why we have the human in the loop scenario.
And what's the accuracy that you guys are looking at?
In terms of it's more than 99% accuracy is what we have to adhere to. We are a very highly regulated industry, so that's the percentage what we look at.
All right. So, of course, when AI is handling billions of claims, trust becomes a big factor. So, how do you make sure the system stays accurate and compliant, especially in such a sensitive space that is healthcare?
True. So we have a zero trust policy in terms of actually definitely actually give the access, but then validate and provide that particular access. And also, since we work in a highly regulated industry, we follow all of the norms which are there, all of the statutory norms in terms of high trust, HIPAA certification, SOC certification. Our environments are actually certified, so and zero trust helps us achieve it.
All right, perfect. One last thing. Everyone talks about a human in the loop, but what does that really look like day to day? Human in the loop AI.
Uh-huh.
So, where do you think automation should stop and human judgment should take over?
Absolutely. So this is an example what we had for the analyzing part of it, right? So we process billions of claims and millions of medical records. So we use AI to do all of the grunt work. In example of extraction, right? It eliminates the manual labor for a person to look at that particular medical record and extract all of the data. That's where we are actually employing all of the AI. And then the decision making is still with the humans, so that the accuracy is actually more. That's where we are doing it.
Well, perfect. I think so. That was quite an insightful conversation, Subha.
Mhm.
And that's all for this video, guys. I'll catch you all in the next one. Thank you for watching.